So today we are going to do a basic overview of the program. We're going to go over the program logistics, some of the professional development aspects, and the benefits of working at Dartmouth-Hitchcock Medical Center. You're also going to have an opportunity to hear from some of our awesome internship program alumni. And at the end of this session, it's my hope that you leave having a better understanding of the program logistics, of next steps, and that you leave excited and ready to apply. So I am joined today by a fantastic group. I'd like to take a quick moment for our speakers to introduce themselves. So speakers, if we can, let's just go down the list seen here really quick for introductions, and I can get us started. As previously mentioned, my name is Melissa Harwood, and I am a workforce development specialist with the Workforce Readiness Institute. Tracy?
Hi, everybody. My name is Tracy Ruggles, and I am a nurse educator with the Workforce Development team. I've been a nurse at DH for about 18 years now, and I work a lot with Melissa on the internship program and also help to deliver the professional development aspects of the internship.
Thanks, Tracy. Julia?
Hi, I'm Julia. I'm a senior at Plymouth State. Last summer, I did the internship on 3 West, and I really enjoyed it. So I'm excited for you guys to learn more about it.
Thanks, Julia. Spencer?
Hi, I'm Spencer. I'm a senior nursing major at Colby Sawyer College, and I did the internship this past summer and was on 4 East, the cardiac floor, which you will hear more about later.
Thank you, Spencer. And Delaney?
Hi, I'm Delaney, and I'm a junior nursing student from Colby Sawyer College. And I also did the internship this past summer, and I worked in the oncology clinic, which was a great experience to be in that inpatient versus the outpatient.
Fantastic. Thank you all so much. So I'm now going to turn it over to my colleague, Tracy, who is going to speak to why we have an LNA internship program at Dartmouth.
Hi, everybody. I'm excited that you're here to learn more about the LNA internship program that we have. Really, this program was designed to help nursing students have an avenue to utilize all of the direct patient care skills that they learn through school. LNA, the role of an LNA is really, really important in teamwork and in how we care for patients. And it's really a great opportunity to come in and work at the bedside and apply the skills that you've learned. Learn how to talk to patients, communicate, work on a team, meet the other people who are on the team. It's a very fast-paced environment. So you really are tasked with learning how to prioritize your tasks and your skills for multiple patients, how to communicate the needs that you have and the needs that your patients have to the other care members on the team. And I think it really helps you to learn the role of an LNA and how important it is. And then you take that forward in the rest of your nursing education, and it really has a long-term impact on how you delegate tasks and work as a team for your patient care moving forward.
Thank you, Tracy. So this program is for nursing students who have completed their sophomore year and have a current New Hampshire LNA license, or at least will be eligible to obtain their New Hampshire nurse assistant license by the beginning of the program. So if you are a sophomore student, once you have completed the fundamentals of nursing class, you are then eligible to become an LNA in New Hampshire by equivalent education. And so in order to obtain your LNA license, you need to complete a New Hampshire Board of Nursing license application. And part of that process also includes having your fingerprints done and having a criminal background check completed. So it is quite a process, and in order to accommodate the LNA license process, as well as regional school end of semester dates, as you can see here, we have 2 cohorts. So they both have the same end date of August 19th, but as you can see here, cohort 1 is a bit longer. It's a 14-week program, and they would start on May 16th. And then cohort 2 would be for 12 weeks, starting on Tuesday, May 31st. The program is primarily run through the Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. We are also looking into having a limited number of sites in Keene, New Hampshire, in case that might interest any of you. The wage is $15.50 an hour, so this is a paid internship program. And you are eligible for overtime and evening or weekend shift differentials, which brings an awesome opportunity to gain some extra compensation. For schedule, you must be able to commit to at least 36 to 40 hours a week. The first week is general and LNA orientation. And then depending on your placement, if you're in the inpatient setting, you would work 3 12-hour shifts per week. If you are in the ambulatory setting, you would work either 4 9-hour shifts or 5 8-hour shifts. And that all depends on your site placement. If you are in the inpatient setting, you are expected to work 2 nights and 2 weekend shifts per month. So in summary, the main requirements of the program are that you will have completed your sophomore year, you will have obtained your New Hampshire LNA license before the beginning of the program, and that you will have a current basic life support certification as well.
I'm going to talk a little bit about the professional development that's offered as part of the internship program. And there are 3 components to the professional development curriculum that we have built in as part of the internship. The first one is workshops that are scheduled into your schedule for the summer. And those are workshops that you will be in with your cohort that you start with. So you get to sort of go through the experience together. The professional development is really important. These workshops are really important because you're working with people and you're taking care of people. So looking at some of those professional soft skills like active listening, teamwork, moral distress, how to handle emergency situations are some of the topics that we will work through in the professional development sessions. And it's a great opportunity for everybody to come back together and share the experience that they have in their site placements and think about how do we build these skills. The learning sessions are, I forgot to say the professional development sessions, just so you know, those are a requirement and they're not optional. So you're required to attend those. The next is the learning sessions, and those are optional. Those are some small group discussions that we offer with DH professionals. And it gives you the opportunity to sit down in a small group one-on-one with them, ask them questions, learn about their path, their journey, their education, the work that they're doing now, and builds, a network of mentors and people that you can make connections with within the hospital. And that's really, one of the benefits that we really like about the internship program. And then there's usually a project that's part of the internship that you would complete by the end of the summer. And that's a presentation that you would, we talk more in depth about it, but it's a presentation that's geared around reflecting on your experiences that you've had over the summer and your personal and professional growth.
Thank you, Tracy. So as an intern, you will have the opportunity to work within either the inpatient or ambulatory setting. So this slide includes a list of the departments that have participated in the past. Depending on the department need, there could be 1 or 2 interns per unit. I think last year we even had 3 within 1 unit. This program serves as a huge staffing resource for Dartmouth-Hitchcock units. And if it's a good fit, there could potentially be an opportunity for you to stay on as a staff member within your host unit, should there be that need. Your site placement is not guaranteed. We work within an equation of looking at the department needs and then reviewing your interests and looking at your skill set and your areas for growth based on the application you submitted and the interview that we will do with you. Some departments will have limited openings, so though we will make an effort, we cannot guarantee that we would place you within your preferred unit. So I would just suggest that it's really important that you mention your flexibility within the letter of interest that you're going to submit within your application packet. as well as identify within there some units that are of interest to you. So I'm now really excited to turn it over to our alumni. They're going to share some of their experiences and insights with you. Spencer, do you mind getting us started?
I don't mind at all. So as I said earlier, my name is Spencer and I did my internship on 4 East, which is the Intermediate Cardiac Care Unit / Cardiac Special Care Unit. It is a split medical, surgical, and step-down unit, with the ICCU being the med-surg part and the CSCU being the step-down portion. And it is a mainly cardiac-focused floor, but you won't exclusively see cardiac. Sometimes you'll have hospital medicine or neurology patients come there. But it's a very fast-paced and interesting floor, as a lot of the patients are there for a specific thing that needs to get treated. And then once that's good, they're out. And then it's very fast-paced and you learn very quickly how to manage your time well and what things are important to do and how to chart quickly and do vitals quickly. It's a very good experience. You learn quite a lot there. The nurses are very willing to teach, especially on nights. And you also learn a heck of a lot about EKGs while you're there. So if that's something you want to brush up on, it's a great place to go. But after the internship had ended, I expressed interest in joining the system staffing office, which is the kind of general float pool for the hospital. So you get to pick your own hours, you get to kind of do your own thing, really, except you don't get to choose where you go in the hospital. You just say, hey, I can work this Saturday, 7 p.m. to 7 a.m. And they will look at the need in the hospital, where they need the most LNAs, and then send you there. And it's a very good experience because you get to kind of go all over the place, see many different things. Like I've been floated to the ED before, I've been floated to a critical care unit. It's a very good experience, and I mainly sought it out because I wanted to see what else was out there after the internship, because 4 East is a very good floor. It's just cardiac is something I don't know if I want to do in the future. So the system staffing office is a very good opportunity to see what other options you have in the hospital. The only drawback is that you need to maintain like a work hour requirement of roughly 24 hours and 28 days. So at bare minimum, that is 2 12-hour shifts a month, which is not too bad. But if you're in school and your workload is heavy, it can be hard to meet sometimes. But overall, a very good experience. And if you're interested in cardiac at all or step down care, I would highly suggest going for 4 East.
Great, Spencer. Thank you for sharing. How about Julia? Are you ready to share with us?
Yeah, so I'm Julia. Like I said earlier, I'm a senior at Plymouth State. Over the summer, I was on 3 West, which is a med-surg floor. That's a lot of like ortho and trauma and just like kind of everything. It's a very busy floor. And so I had a lot of learning, and I feel like I learned a lot about myself and what I kind of can see myself in the future. You learn a lot about time management, like way more than I ever thought I would, and way more about interacting with different patients, because there's a lot of psychosocial needs on that floor. And so I learned a lot about communicating with patients, and just like my confidence overall with patient care went up, because I was not an LNA previously to this experience. So I think that I keep telling everyone, like all the people in the grades below me right now, I keep telling all of them to look into this when they get to that age or to that grade, and just how important it is, I think, to be an LNA, and how much it really opened my eyes to what I can see myself in the future.
Thank you so much, Julia. And Delaney.
Hi guys, so I'm Delaney and I'm a junior nursing major from Colby Sawyer College. This summer I had the opportunity to actually work in an outpatient clinic, which was a new opportunity for me since I previously had worked as an LNA inpatient. I'm from Connecticut, so I worked at a hospital back home for their float pool. So I worked anywhere from the ICU to the ER to regular med-surg. So this was quite a change to be on the outpatient side, but it was a great learning experience. So some of the roles as an LNA for the outpatient is you will room patients. So I was in the oncology clinic. So patients coming in for chemo or patients coming in to meet with their oncologist, would come for their appointments, and you would bring them into a room. You do things like go over their medications, you take their vitals, you'd ask them simple questions about how they're feeling, things like that. So it's kind of a little bit of a different role as an LNA there. It's not so much care as it is getting them ready to see their provider, and a lot of talking and emotional support. So that was a great aspect that I got to work on as skill, was how to really communicate with patients who just needed someone to talk to. So I highly recommend, if you are an LNA in the inpatient, you should definitely try the outpatient, because I loved being able to have both experiences. And if you do end up in an outpatient clinic, you don't work 12 hours. I worked 4 days a week for 9 hours. So their shifts are a little bit different if that works with your schedule a little bit more. And I actually ended up loving the clinic so much that I expressed interest in staying on as an LNA. And I currently still work in 3K, the oncology clinic now. So I work a couple hours a week while I'm in school still to this day. So I really like the job.
Perfect. Well, thank you all so much for sharing your experiences. So now that we've gone through the program overview, I'm going to cover for us how to apply. So applications open on November 15th, and the application deadline is February 1st. So you have some time to put together your materials. When you are going to apply, you're going to fill out an online application, which is found on our website at dhwri.org. For materials, you will need to submit a current resume, a letter of interest, and then one letter of reference. We will then hold interviews the week of February 21st. And I would just also want to mention that in your letter of interest, I would encourage you to identify some of your career objectives and highlight some of the units or departments that you might be most interested in working for. So some of the benefits of working at DH and participating in the LNA Internship Program are listed here. Personally, I think this is a really influential program in that you are gaining valuable work experience. You're learning hands-on, you're making great connections, and you're making an impact within the community. So additionally, there will undoubtedly be continued work opportunities for you following the internship program if that is of interest to you. And you can see once you continue work, there are some scholarships that would be available to you through the Nurses Week, or you would then also be ready to take on the tuition reimbursement if that was something that you would choose to do. And Tracy, do you mind covering some opportunities for starting work now?
Sure, I'd love to do that. As you heard from Spencer, there's opportunities to continue working after the internship is completed, but we just want you to know that we realize that the internship won't be starting until next summer. And if you want to start getting into the environment and looking at exploring your interests, that there are opportunities for you to start working now. We know that you're all in school and you have very busy schedules, and that school is really demanding. But if you're eager to get in and get started, we're really willing to be flexible and work with you to see what we can, what's available for you to get into the environment and start working or exploring.
Awesome, thank you, Tracy. So I'm now going to open up for any questions that you might have. We hope that this session has been informative, and hope you know that we are here to support you throughout the process. But if you have any questions at this time, we're happy to field them. Otherwise, you can email us at wri@hitchcock.org. To apply, we have the website link here. And then also, if you're coming from out of state, we just want to make sure that you understand we do not provide housing, but this should not deter you from applying. And there might be an opportunity to have some summer housing at Colby-Sawyer College as well. So I would just recommend that you apply and go through the process, and then we can work out those logistics with you as we come to it. Are there any questions that we can address at this time? You can either submit them in the chat if you'd like, or please feel free to turn on your video and unmute yourself if you'd like.
We already have one question in the chat, Melissa. So Victoria is wondering how many positions are available for this program and how many acceptances are there per year?
Awesome. That's a great question. So we are aiming to have a class size of between 30 to 40. It is a competitive program and we work to hire the best that we can find. And it's really a matter of matching and placement. We had a candidate last year who showed a lot of desire to work within the psych unit. And at the time, we didn't have them as a participating unit, but because this candidate was so perfect for that role, we were able to create a site location for them. So I just say that, and also having you understand that it can also be very organic. And if there is a department need, and if you hold a certain skill set, we will try and work you in. So we're dedicated to long-term careers and helping you develop to become an amazing nurse. So I would just say to make sure to submit in your letter of interest that desire of a unit, and also really try and show us why you would be a good fit.
Melissa,
Tracy, is there anything you want to add?
Yeah, before you go on to the next question, I just wanted to say it's also great to know if you have flexibility or if you're willing to take other opportunities, even if they're outside of what you've specified as your area of interest. I think like Delaney shared, you know, going to the ambulatory clinic was probably different than she had originally conceived or expressed. But if you're willing to just take the opportunity that's offered to you, that's great to know as well. Like we said, placement sites are different every year, and it is sort of on a rolling, changing basis. So it's good to share if you're like, these are my interests, but I'm also willing to just get in there and explore and take, you know, be considerate of any experience that might be there for me.
Thank you, Tracy. I see Naomi has a question in regard to summer housing, if it would be included in the stipend for the internship or considered an out-of-pocket expense. So that would be considered an out-of-pocket expense. The program is a paid internship program, so it's not that you have to spend what you're receiving on a
Can you guys hear Melissa, or did she freeze? She froze. Okay, so I will pick up and just say that it is a paid position, so that you are paid for your work, but the housing is an out-of-pocket expense, or arranging your own housing is we don't provide housing or make arrangements or pay for that for you. So the shortest answer to that is it's an out-of-pocket expense. Oh, we lost Melissa, or oh, there she is.
Heather is wondering, how do we go about starting right now? Do you want to take that one, Tracy?
Sure. So I think the best way to go about this is to email us with your interest at the DHWRI at the email, and then we can individually, or Holly Ann can put it in the chat so that you can have the email there, and we can work with you individually. Some of the opportunities would vary based on the hours that you're available and how many hours you're available, and also what your interests are. So if you email us at that email that Holly Ann put in there and just say, I was on the LNA info session tonight and I'm interested in working, then we can work with you individually on that. Sure, no problem. Any other questions from anybody?
I have some that came in from the registrations if we want to do some of those. Might be helpful, and if anybody's wondering.
Sure.
So there was somebody wondering if they get the chance to shadow other specialties during the program.
Yeah, so there would definitely be an opportunity for you to shadow. That would be coordinated through your nurse manager. But like I said before, Dartmouth Hitchcock has a strong belief in continuing your learning opportunities and growth. So it's definitely a desire within the units too, to make sure that you are expanding your knowledge. And depending on your placement, you just would want to make sure to coordinate that with your nurse manager at the time. And then we could also help if there was a specific unit or specific individual you were looking to shadow with that your nurse manager might not be able to make that connection to, then we would be able to help you as well. But a lot of this program isn't about shadowing, it's about working. So though there is the opportunity, there is the expectation that you're primarily going to be working within your unit.
With that, I think somebody had also sent in a question asking if it was a combination of being able to use your nursing skills and work as an LNA. And I just wanted to sort of go off what Melissa was saying, is that I'm sure that Spencer and Julia and Delaney can say that you will have lots of opportunities to observe, you know, nurses working and observe either procedures or different things that are happening. And we're always supportive of that when the opportunity is right to do that. However, the goal of the program is for you to be here and to be integrated into the unit as an LNA. So you're hired on, you're an employee, and you will have LNA work and tasks that you're doing. So the primary goal of the program is for you to really develop those skills so that you feel stronger in those foundational skills. And then you will always have the opportunity to observe or to be included in learning about the nursing process, and you'll be observing it every day. And our nurses are really, you know, supportive of helping you to grow. We just want to be clear that when you're here, your goal is to work as an LNA and really hone those skills. I wonder if, like, and I don't want to put Spencer, Delaney, or Julia on the spot, but did you feel more confident going back to school this year after working? Like, did it change how this year of nursing school has felt for you at all?
I definitely noticed a big difference, especially when I talk to my peers, because I'm in my second semester of med surg now, and I'm doing way better than I would have if I wasn't in the course or in the internship. And I think it's strictly because I was able to, when patients would come in for whatever diagnosis, I would really look into that diagnosis. And then I would whenever I had spare time, I would ask the nurses oh, why are you doing this? Or why is this happening with this patient? And I would really try to actually think about what was happening. So I was always trying to relate things back to school, even though that's not what I was doing LNA tasks and that was my priority. But whenever I had a minute, or even whenever I was helping a patient, I would always try to relate it back to school. So I think that's definitely helped a lot.
And on the more, sorry.
No, that's okay. I was just going to say, I can see how, for you, when you're thinking about academics and when you learn about disease processes and what happens, and when you're there with the patient, you're seeing it. You know, you're really seeing what happens to a patient when these things are happening, and it really helps to put all those pieces together. Sorry, Spencer.
No, you're good. But on the more skills, I definitely noticed a difference because I was part of the class that had their first clinical experience cut short by the pandemic. So kind of going into this year and being able to be confident in skills like being able to do a bed bath or doing Foley care or helping patients walk, it really makes a difference to be okay, I am confident in this skill and I feel comfortable doing this. It makes a huge difference having those core foundation LNA skills under your belt.
Great, excellent.
I also can add the same thing. Since I started as a sophomore going to my junior year, I felt like I was a little bit ahead, since some of my peers at the start of this clinical experience never had put a patient on a bedpan or never helped a patient go to a commode. So it's just kind of some of those simple things that you start this year in clinicals as a junior that I had already felt confident in from over the summer.
Great. Thanks for sharing, guys. On the spot there.
Any other questions, Holly Ann, that we should cover?
So there were a couple more questions that I found in here. So one was, are we able to pick our schedule day-wise?
Tracy, do you want to cover that?
Sure. So I would say that if you're in the clinics, your schedule is probably a little bit, like Delaney was saying, if you're working the 4 days a week, you might have some flexibility as to what day of the week that is. Usually with scheduling, what happens is when you first start, they might plug you into the schedule and where they have the need. And then after that, a lot of times we do what's a partial like self-scheduling process where you can you can go into our platform and you can put yourself in for certain shifts. I would say that working 312s offers a lot of flexibility in your schedule for what days of the week that you work and when you work, outside of the requirements of working the night shifts and or the weekend shifts. And also, if you have a conflict with your schedule, usually the other people that you work with on those units or something, if they can, they're usually pretty good about helping to do swaps and stuff like that. The days that aren't flexible is when we have professional development days, because we put that into your schedule so that your unit managers know that you should not be scheduled for a shift on the unit, like, this day of the week at this time, because you're going to be with workforce development for your professional development session. And when those happen, we ask you to try to not schedule yourself the night before or directly after that, which I'm sure some of our alumni could tell you. They learn it's hard to work all night and then come to a professional development session for 4 hours from like 8 to noon. So we give you that schedule ahead of time and encourage you to share with your managers, and we are going to continue to do more work to share with the managers what the schedule is for the professional development sessions, so that you're not working directly around that.
And one last question actually related to the professional development is where do they take place, the workshops, and what is the content discussed?
So the professional development sessions take place up here in Lebanon, either at the main campus or at one of our conference locations that we have near the hospital across the road. And I would say that most of the professional development, we covered it on that slide, but it's usually around the soft skills, around communication, teamwork, doing some self-discovery with yourself. The environment of which healthcare workers are in these days asks a lot of us emotionally, and healthcare in general, we're always like giving of each other. So we do some reflection and resilience and teamwork and effective communication, because that's really like the number one key thing in healthcare, is figuring out how to gather information and package it in a way that you can care for the patient.
Awesome. Well, thank you all so much for joining us tonight, and thank you to our speakers for providing such great insight and information on your experience. We again hope that you leave this session with a better understanding around the program logistics and next steps, and that you are excited to apply come this Monday, November 15th. So if you have any questions beforehand, feel free to reach out to us with the email address Holly Ann put into the chat. And I look forward to seeing some of your applications come through soon. Have a great evening, everybody.
Thank you, everyone. Thank you, Delaney, Spencer, and Julia.
Thank you.